Hi, this is Dr. Theresa Rohr-Kirchgraber coming to you from Eskenazi's Women's Center of Excellence. We're talking today about whether or not you have a flu, the cold, or allergies. This time of year, everybody seems to come down with something, and they're always concerned about what it could possibly be and how to treat it, when to come to the doctor, and when to stay home. First, no matter what you have, if it's something infectious, stay home and keep the germs to yourself. Now let's talk about some of the differences between flu and cold. Well, first, when you get the flu, it's usually not very subtle. You wake up and you feel okay, and then all of a sudden, very acutely, you just hurt and feel horrible. It's as if every muscle in your body is aching. You start coughing. You cough so hard you feel like your head's going to blow off. And then you get the high fevers, and the fevers can be even as high as 101 or 102. The flu is not subtle, and the flu means stay home. You may want to call your physician. There are some medications that can be helpful for the flu. They do tend to just kind of decrease the symptoms by like a day or so, but you do want to make sure that you keep yourself well hydrated. Don't worry so much about eating, but just treat the symptoms of the flu. The medications, the antiviral medications that can be helpful, really must be given within the first 24 to 48 hours to have any significant effect. We know that the best way to avoid the flu is to get the flu vaccine, and we still encourage it even through usually about March or so. The flu vaccine is going to vary every single year, but it can be the most helpful in preventing it from coming. So, symptoms of the flu: muscle aches, severe muscle aches over everything, high fevers greater than 100, sometimes shaking chills, a cough. Usually the cough is kind of non-productive, but it can be a little bit productive. And the cough is just severe and really annoying. Chronic headaches, those kinds of things. And you should recognize it comes on pretty fast. If you start to feel it, best to call and ask your primary care physician whether or not they'd be comfortable ordering you a medication, or if you just need to kind of tough it out at home. All right, now let's talk about colds. Colds are annoying. Colds usually occur because everybody's kind of closed in and the virus find a way of traveling about from person to person. A cold generally kind of starts over about 4 days. You start by feeling a little bit under the weather. Maybe you've got a runny nose, maybe you're sneezing a little bit more, getting a little bit more sinus congestion. You have kind of a sore throat, maybe then a little cough. All of those symptoms kind of come on over the course of about 3 or 4 days, and usually in varying amounts. It's like you kind of know something's going on, but you're not quite sure what. Normally, there's not a high fever associated with it. And the cough initially is kind of a dry cough. You're coughing more because the lining of your lung is kind of irritated and swollen. Usually after about 4 to 5 days of that, then you start to bring something up. And it's not that there's gunk stuck in there that's not finding its way out. It's just that those first few days, it's more about being kind of swollen and irritated. And then the kind of exudate and the gunky stuff kind of develops as you're into day 4 or 5. You can have some sinus pressure just because with that viral infection, it's kind of irritating things. So it's irritating the sinuses as well as the back of your throat, as well as the lining of your bronchial tubes in your lungs. Sometimes that sore throat can be because of some postnasal drip. And so as that stuff kind of drips down the back of your throat and down into your chest, it can be really irritating. So what we recommend for the cold is, 1, try to avoid it. Always make sure to wash your hands, cough or sneeze into your elbow so you're not passing it around. You can use some over-the-counter medications that can be useful. For example, chlorpheniramine, which is quercetin. That's the best if you have high blood pressure because it doesn't usually raise your blood pressure. The other antihistamines can also be helpful to decrease that nasal drip. Sometimes an anti-inflammatory medicine like Motrin or Naproxen can be helpful just to decrease the amount of inflammation that's going on in your sinuses. I find one of the best things is just some steam inhalation. Steam inhalation. Get that pot of water boiling on the stove, move it over to the table, sit there with the cloth over your head, and really get that steam up into your nose. Colds and flus are just nasty things this time of year. Take care of yourself. Call your physician if you're not sure. And the best of all is prevent it from happening by getting your flu shot, washing your hands frequently, and staying home if you're sick. This is Dr. Theresa Rohr-Kirchgraber from Eskenazi. Thank you.